Statistics are really tricky, and a lot of the mistakes or challenges that reporters come into or face when they're reporting on HIV are very common for anything where you're talking about epi data and data in general, but there are some specific ones related to HIV. What I see is that the most common things that reporters really confuse the data that they're trying to talk about.
They're all estimates. They don't, the numbers we see on UNAIDS and the other very reliable sites are extrapolations from small samplings of data. And so they're estimates. And we've seen over the last 25 years, we've seen the estimates go up, then we see them go down, then we see, oops, we overestimated by several million, or perhaps we underestimate. So bearing in mind always that it's an estimate is a good idea.
It's one of those things of which statistic do you choose to use? Do you use the one that is most dramatic? Because you could say that the overall rate of infection in South Africa is around 10%. If you look only at women who are, childbearing age, you'd say 20%. Now, I'm sure most reporters, we generally do is go for the 20% figure because we figure it's more representative, it gets people's attention more, and epidemiologists do believe it's representative of a really serious situation, what's going on in the country, and the lower number can be misleading. So it's a question of what is most representative, what gives you a clearer picture of what actually is going on.
Check as hard as we can. We do our own math in some cases. We call the national councils on AIDS in different countries. We try to triangulate the numbers and see if they make sense. If the numbers look too fuzzy, we don't report them. We say, figures are not reliable, but something like that. So, and the other thing we do is we make our research transparent. If you can find good numbers, or that you triangulate, that you source 3 times, and you're comfortable, but if not, what we found useful is to say, this is what this agency says, this is what we hear from these people. On the ground, the people at the AIDS Service Organization told us a different story. Just be completely transparent.
In a news report, I think the basic data that a reporter should understand and be able to talk about with all of the right qualifications that you can do in a short story, and I recognize that there are limitations, are incidence and prevalence. And those are 2 terms that you might not see in a story, but are really important for reporters to understand before they go reporting.
One thing that happened relatively recently was when I got some data from the health department, and I was playing around with it in Excel and trying to do some graphs. And then I got a second data set, and I noticed that some of the numbers were off. And so I contacted the analyst at the department and realized that there were numbers under cumulative cases of HIV, and that I didn't even think about it, but I was reading cumulative to mean prevalence. So that's something that if you have to pay attention, and if it says incidence, or if it says prevalence, or if it says cumulative, because cumulative, of course, includes people who are dead, whereas prevalence is just people who are still living with the disease, and incidence is people who are newly diagnosed in a given period. So I think just paying attention to the headings on those tables when you're looking at the data is very important.
HIV incidence, for example, is the number of new infections that are occurring. So if we want to know the most recent trends, how many new infections were there in a country, that's incidence. On this graphic here, there's a visual depiction of this, and it shows on the left side of it people that are infected. The circles there are supposed to symbolize people who have HIV. And on the right side is a population that's not infected. As those people move in, let's say this is in a 1-year period, that's incidence. Those are the people newly infected. So this is trying to show that that group of new people are the newly infected people. prevalence, the number of people with the disease, tells us what the current burden is in a place. What this graphic shows for prevalence is a population, and within that population, you see circles around some of the people. That's the number of people with the disease at a given point in time. That's your prevalence.
Incidence is going to be more important to understand, and that is because there are new models now being developed that will try to measure who were the last 1,000 people who were infected with the disease. What is the incidence rate in the population? So more and more reporters are going to be hearing these different terms, incidence and prevalence. And the thing to look out for will be very important in terms of how different prevention techniques are working, is to understand incidence, to ask questions about incidence. Who's infected in the last 6 months? What is the incidence rate? In that way, you can measure whether these efforts to prevent the spread of the disease are working. The prevalence is a general way of looking at it that doesn't really tell you too much about whether prevention techniques are working.
The best thing to do when you're going to report on an HIV story and you need to use data is to go to an official source. The official, like a health department, if it's global data, UNAIDS or WHO, if it's country-specific data, those sources as well as potentially the country that you're talking about, to start there. It doesn't mean you would end there, but to start there, because the official data, even if they're estimates, even if they have some limitations, they've at least been vetted, and they've also been looked at from a comparative sense. So when you're talking about one country and you want to look at 2 countries or 3 countries, if you go to that official larger source, it's more secure in your comparisons.
I found the health department to be a good source of information. And another thing too is if they're not short-staffed and they have people who have the time to help you, they can help you get just lots of raw data rather than just looking for reports that are done in a preset manner. They can give you raw data that you can then play around with the way you want. So if you want to calculate proportions of women versus men or blacks versus whites or any kind of thing that you want to do yourself that isn't necessarily required for a report they're sending to the CDC, then if they give you the raw set of data, then you can play around with that. And I find the people at my health department are willing to help me with that.
And you have to seek that out. You have to ask for that.
Right, right. And it comes with building a relationship. And this is what I've found that and I didn't necessarily set out to build a relationship with people in the community, but I think in showing up to the different places and writing the stories, then everyone started paying attention to the work I was doing, and then people would recognize my name. They wouldn't necessarily know me, but then I'd go to the health department and I'd ask for something and they would know my name. And so people would be willing, and they don't always have time, but when they do have time, they're generally willing to help me.
Think about what the numbers mean and what they're saying. Sometimes the numbers themselves aren't as important as what does it say about the situation. So what's the context of, what does the number mean in the context of that community or that family or that specific story that you're trying to tell?
It's a very complicated territory, and reporters need to know that's just a common thing. It's not about their reporting. It really is complex, even for people working in it day to day. And that's why we at Kaiser, as well as other organizations, are there to try to help walk people through. I think the biggest thing is to not, if you don't understand something, chances are it's because it's complicated. So find someone who can help, but don't just report on it, because it probably is complicated and nuanced, and it's important to understand that.